Selective IgM deficiency is an immunodeficiency disorder. Look at this picture. Signs and symptoms, complications, detail going on. Introduction. Selective IgM deficiency is a rare primary immunodeficiency disorder characterized by abnormally low serum levels of immunoglobulin M IgM, while other immunoglobulin remain normal. IgM plays a crucial role in early immune response, hence its deficiency predisposes affected individuals to infections, autoimmune disorders, and allergic diseases. Definition. Selective IgM deficiency is defined as serum IgM level below 2 standard deviations of the mean for age, with normal levels of IgG and IgA. In the absence of secondary causes, example medications, malignancy, protein losing conditions. Etymology. Selective. Only one immunoglobulin type is specifically affected. IgM, immunoglobulin M, the largest antibody and the first produced during an immune response. Deficiency, insufficient levels in the bloodstream. Epidemiology, rare condition, true prevalence unknown. Estimated occurrence 0.03% to 0.1% in the general population, can affect children and adults. Slight male predominance reported in some studies. Many individuals remain undiagnosed due to mild or asymptomatic pre-sensation. Types. 1. Parietal selective IgM deficiency. IgM levels are low but detectable. 2. Complete selective IgM deficiency. Little to no IgM detectable in serum. 3. Primary due to intrinsic immune system defect. 4. Secondary acquired resulting from medications, infections, or other diseases. Causes. Exact cause is unknown. Possible contributors include 1. Genetic abnormalities, B cell function, 2. Defects in IgM production pathways, 3. Autoimmune mechanisms, 4. Environmental triggers. 5. Secondary causes. Medications. Example, immunosuppressants, lymphoma, nephrotic syndrome. Risk factors. 2. Family history of immunodeficiency. 2. Autoimmune disorders. 3. Allergic diseases. 4. Recurrent infections. 5. Use of immunosuppressive therapy. 6. Protein losing states or chronic illness. For secondary SIG-MD. Complications. 1. Recurrent bacterial infections. 2. Chronic lung disease or bronchiectasis. 3. Autoimmune disorders. Example, SLE, rheumatoid arthritis, thyroiditis. 4. Allergic conditions. Asthma, allergic rhinitis. 5. Increased risk of certain malignancies. 6. Poor vaccine response in some individuals. Pathophysiology. Pathophysiology of selective IgM deficiency. Step-by-step process. Step 1. Defect in B cell development or function. B cell normally produce IgMs, the first antibody in any immune response. In S-IgMD, there is a reduction in the number of IgM producing B cell or a failure of mature B cell to secrete IgM. The exact mechanism is unknown, but abnormalities may occur in pre-B cell maturation, B, C receptor signaling, plasma cell differentiation. Step 2. Reduced or absent production of IgM. Even though B cell may appear normal in number, the cells do not produce sufficient IgM. Serum IgM level fall below normal for age, while IgG and IgA remain normal. Step 3. Impaired primary immune response. IgM is the first antibody made when a pathogen enters the body. With low IgM, the body initial defense against microbes in weakened, respond to encapsulated bacteria is less effective. This leads to recurrent cynopulmonary and bacterial infections. Step 4. Reduced complement activation. IgM strongly activates the classical complement pathway. Low IgM, reduced complement activation, impaired opsonization and microbe killing. This contribute to recurrent infections and poor clearance of pathogens. Step 5. Inefficient class switching and immune regulation. Although IgG IgA levels are often normal, the trigger for class switching IgM is weakened. Some patients shows poor vaccine response, reduced specific antibody formation, altered T cell and B cell interaction. Step 6, increased autoimmunity risk. IgM has an important role in clearing apoptotic cells and maintaining immune tolerance. Its deficiency leads to accumulation of cellular debris, increased presentation of self antigens, loss of immune tolerance. This contribute to high rates of autoimmune diseases. Example SLE, thyroiditis. Step 7, increased allergic and atopic responses. IgM normally down regulates allergen induced responses. Deficiency may cause allergic rhinitis, asthma, eczema due to imbalance between immune regulating antibodies. Step 8, progression toward complications. If the deficiency is moderate or severe over time, recurrent lung infection, pancreatitis, chronic inflammation, tissue damage, present immune dysregulation, autoimmune disease. In summary, simplified flowchart: 1. Genetic immune defect. 2. B cell ability to produce IgM down. 3. Down serum IgM levels. 4. Down first line immune response. 5. Reduce complement activation. 6. Elevate susceptibility to infections. 7. Increase immune dysregulation and autoimmunity allergy. 8. Increase risk of chronic complications. Stages. Selective IgM deficiency does not have formal stages, but clinical progression can be decreased by us. 1. Asymptomatic stage. Incidental finding. 2. Mild symptomatic stage. Occasional infection. 3. Moderate stage. Recurrent respiratory GI infections. 4. Complicated stage. Chronic infections, autoimmunity, organ damage. Signs and symptoms. 1. Recurrent xenopulmonary infections, otitis media, sinusitis, bronchitis, pneumonia, 2. Gastrointestinal infections, 4. Allergies and asthma, 5. Autoimmune symptoms, 6. Fatigue or poor growth in children, 7. Occasionally asymptomatic. Diagnosis: 1. Laboratory test: serum immunoglobulin low, IgM normal, IgG and IgA, lymphocytic subset analysis, vaccine response testing. 2. Clinical evaluation, history of infections, autoimmunity. 3. Exclusion of secondary causes. 4. Genetic test, rare and investigational. Nursing diagnosis: 1. Ineffective immune response related to low IgM levels. 2. Risk for infection related to immunodeficiency. 3. Activity intolerance related to recurrent illness. 4. Anxiety related to chronic disease diagnosis. 5. Knowledge deficit regarding disease management. Medical management: no specific cure for SIGMD. Symptomatic and preventive care: 1. Antibiotics for acute infections. 2. Prophylactic antimicrobials in severe cases. 3. Treatment of associated allergies and autoimmune conditions. 4. Immunizations, not response may be reduced. 5. IVIG therapy only in selected cases with poor vaccine response. Nursing management: 1. Monitor for signs of infection. 2. Educate on hygiene and early reporting of symptoms. 3. Ensure vaccination schedule adherence. 4. Assist in medication administration. 5. Promote balanced nutrition and hydration. 6. Support psychosocial well-being. 7. Coordinate follow-up appointments with immunology specialist. Treatment options: 1. Antibiotics, therapeutic or prophylactic. 2. Immunoglobulin replacement therapy, IVIG, for those with impaired IgG responses. 3. Management of autoimmune diseases. 4. Bronchodilators, steroids for asthma and allergies. 5. Lifestyle modifications, nutrition, rest, infection prevention. Psychosocial medicine: 1. Counseling, psychoeducation help client understand chronic illness. 2. Support groups, connect with others with primary immunodeficiencies. 3. Stress management techniques, mindfulness, relaxation, coping skills. 4. Family education, enhance support and understanding. 5. School, workplace advocacy, accommodations for frequent illness. Prevention. Yes, IgMD itself cannot be prevented, but complications can be. 1. Good personal hygiene practices. 2. Avoiding exposure to infections. 3. Early and appropriate treatment of infections. 4. Regular medical follow-up. 5. Staying updated with vaccinations. 6. Balanced diet and healthy lifestyle. In conclusion, selective IgM deficiency is a rare but immunodeficiency characterized by low IgM levels with normal IgG and IgA. While some individuals remain asymptomatic, others may experience recurrent infections, allergies, or autoimmune disorders. Early recognition, careful monitoring, and appropriate medical and nursing interventions can significantly improve quality of life. Multidisciplinary care and psychosocial support are essential components of comprehensive management. Thank you. Have a nice day.